Basketball fans from around the nation watched in shock yesterday as Pacers All-Star Paul George fractured his leg while playing in the USA team scrimmage. George was immediately rushed to a Las Vegas hospital where he underwent surgery. And now the question becomes, will George be out for the entire season? Joining me now is Dr. Daluga, an orthopedic surgeon here in Lafayette. Dr. Daluga, thanks so much for joining us. And
thanks for having me.
Absolutely. And I have to ask, first of all, you said you didn't see it live, but you went back and watched the injury. When you saw it, what was your first reaction?
I thought it was gruesome like everybody else, pretty scary.
And tell us, this sort of injury, obviously it's hard. You know, you didn't get to see it happen in person and you're not treating Paul George, so you haven't seen it yourself. But these types of injuries you said are actually common. Tell us a little bit about that.
They're not uncommon for fractures. In fact, it's the most common long bone fracture that you can have. And the bone is very superficial and very thin in this area, so it's not uncommon that it could snap right in the middle like it did with Paul. So the way it was treated is then you place this titanium rod down the center of the canal, and this will then stabilize the fracture site, allowing him to start putting weight on it almost immediately.
And let's talk a little bit about the recovery process. How long could something like that take?
Usually they can heal between 3 and 4 months, but then after that you have to heal all the collateral damage with the muscles and the ligaments. And so basically we're hoping that he would be okay by 8 to 12 months. Now Kevin Ware, who had an initial similar injury as of this, was back in 7 months, but I think that's more of an anomaly.
And so are you thinking that this year George will not return to the court for the Pacers?
I think it'd be really difficult for him to do that.
And once he finally does return, even if it is next season, do you think that he can ever play to the caliber that he once did?
Yes, I think he can still be an all-star and come back to his previous potential.
All right, Dr. Daluga, thank you so much for your expertise. Of course, our thoughts are with Paul George and the Indiana Pacers tonight. We, of course, wish him a speedy recovery.